Good evening. I am Mrs.K.Punitha, Assistant Professor in Srimalaji College of Nursing. Now we will see the topic of examination of bone marrow in pathology. Bone marrow aspiration means the first we'll see the definition. Bone marrow aspiration is a procedure performed by the doctor where a special needle is inserted into the bone marrow to obtain bone marrow tissue specimen. Bone marrow aspiration is a procedure performed by the doctor where a special needle is inserted into the bone marrow to obtain bone marrow tissue specimen. Define biopsy. Removal of a small core of bone marrow under local anesthetic. It is used to assess bone marrow structure, the number and distribution of all types of blood cells. Trifid biopsy is 1 to 2 centimeter long, 2 to 3 millimeter in diameter of the marrow containing bone taken by the rotating specialized needle under pressure. Trifid biopsy needle is Jamshedi needle. Then site for Trifid biopsy, the posterior superior iliac spine, that is most common site, then anterior superior iliac spine, then spinous process of vertebra. This is the site for Trifid biopsy. Site for Trifid biopsy are posterior superior iliac spine, it is the most commonest site, then anterior superior iliac spine, then spinous process of vertebra. Then cells which are studied through bone marrow aspiration are erythrocytes, leukocytes, then thrombocytes. The cells which are studied are erythrocytes, leukocytes, then thrombocytes. Indication for bone marrow aspiration. Diagnostic, systematic diseases, staging of lymphoid malignancies and solid tumors, then detection of infection, then iron stores, miscellaneous disorders, example pancytopenia, then post-treatment follow-up, then therapeutically BM transplantation, that is bone marrow transplant. Indication for bone marrow aspirations are diagnostic, then systemic diseases, then staging of lymphoid malignancies and solid tumors, then reduction of infection, then iron stores, and miscellaneous disorders, example pancytopenia, then post-treatment follow-up, then therapeutically BM transplant. First diagnostic, primary hematolymphoid disorders, that is red cell disorders, example megaloblastic anemia, pure red cell aplasia. One is red cell disorder, example megaloblastic anemia, pure red cell aplasia. Then B is white cell disorders, example leukemias, diagnosis and classification of acute leukemias. Then B is the white cell disorders, that is example for white cell disorders are leukemias, diagnosis and classification of acute leukemias. Then C is the megakaryocytic disorders, then ITP and other thrombocytopenias. Next condition is here myeloproliferative neoplasms, that is PV and CML. Then next condition is MDS, then plasma cell neoplasms. Under diagnostic, we will see the primary hematolymphoid disorders. Under primary hematolymphoid disorders, we are having red cell disorders. Example for red cell disorders, megaloblastic anemia, pure red cell aplasia. Then white cell disorders, example leukemias, diagnosis and classification of acute leukemia. Then megakaryocytic disorders, ITP and other thrombocytopenias. Next, myeloproliferative neoplasms are PV and CML. Then MDS, plasma cell neoplasms. Then systemic diseases, that is storage disorders, Gorchak disease, then staging of lymphoid malignancy and solid tumor. A is a lymphoma, then B is a metastatic deposit, that is prostate, kidney, lung. Next, detection of infection. One is the parasitic infection, example Kala Azar, then B is a fungal infection, that is histoplasma. Deduction of infection, one is parasitic, example Kala-Azar, then B is a fungal, histoplasma. Then bone marrow aspiration needles commonly employed for the aspiration of the marrow or Sala needle, then Klimma needle. The needle commonly used are Sala needle, then Klimma needle. These are the types of needles, that is Klimma needle, then Jamshidi needle. So this is the examples for types of needle. And this is also the example of type of needle. Then site for bone marrow aspiration. What is the site means? Sternum, that is second space of sternum, then posterior superior iliac spine, then iliac crest, next anterior superior iliac spine, then spinous process of lumbar vertebra. In infants, upper end of the tibia is the ideal site for marrow aspirator. Site for bone marrow aspiration are sternum, second space of sternum, at posterior superior iliac spine, then iliac crest, and anterior superior iliac spine, and spinous process of lumbar vertebra. For infants, upper end of the tibia is the ideal site for marrow aspirator. This is the site for bone marrow aspiration. And possible complications are infection and bleeding. The possible complications are infection and bleeding. Then risk factors for complication. There are some of the risk factors are there for the complication, that is bleeding disorders, infection of the skin overlying the area from which the biopsy is to be taken, then infection in the bloodstream, and severe osteoporosis. Some of the risk factors are there for the complication, that are bleeding disorders, infection of the skin overlying the area from which the biopsy is to be taken, infection in the bloodstream, severe osteoporosis. Then assessment. We need to do the assessment while doing the bone marrow aspiration and examination. First of all, we have to check doctor's orders in progress note. What we have to check means right client must be checked. Then select site for procedure. Then any pre-medication order is there, we have to follow that. Then check for consent form is signed by doctor and client. So first of all, we need to check the doctor's orders in progress note. What does the doctor's order means? Example, right client, selected site for procedure, then any pre-medication order, then check for consent form is signed by doctor and client. Then assess the client. We need to assess the client. What we need to assess the client means, that is level of consciousness or restless, then ability to assume position required for the procedure. So we need to assess the client for the level of consciousness or restless, then ability to assume position required for procedure, then skin of procedure site, then vital signs. We need to monitor the vital signs, then notify for lab technician on call. So we need to assess the client for level of consciousness or restless, then ability to assume position required for procedure, then skin of procedure site, then vital sign we need to check, then notify for lab technician on call. Next, equipments. Some of the equipments are needed for the bone marrow aspiration. Formalized tray, then big tray with disposable dressing set, extra cotton balls and gauzes, then one pair of sterile gloves, then face mask, then one fenestrated towel will be needed. So these are the equipments, that is formalized tray, a big tray with a disposable dressing set, an extra cotton balls and gauzes, one pair of sterile gloves, face mask, one fenestrated towel. So this is the needle, example for needle. Next, implementation. What we supposed to do means, first of all, we need to wash our hands. Then greet client and check ID tag. We need to check the identification card of the patient. Then we need to explain the procedure to the patient. Then we need to provide privacy for the patient. Then we need to adjust the bed. Then second, nurse precision client according to doctor's chosen site for procedure. Then expose the insertion site. Then bone marrow aspiration needle with the inner stillet, then cleansing solution, that is surgical spirit 70% and povidone iodine, then glass slide and glass marking pencil, then formalin 10%, then fixative for BM, then EDTA and no-heparin tubes. So what are the implementation means? We need to wash our hands, then greet client and check identification tag, explain procedure to the patient, and provide privacy for the patient. Then we need to adjust the bed. And second is position client according to doctor's chosen site for procedure, then expose insertion site. Next, bone marrow aspiration needle with inner stillet, then cleansing solution we need to use, then glass slide and glass marking pencil. Next, formalin and fixation for bone marrow, then EDTA and no-heparin tubes. Next, the first nurse assist. What she has to assist means the doctor throughout the procedure. Then the first nurse assist doctor throughout the procedure. Then open dressing set followed by all sterile items as per requirement needs. Then pour solution. The nurse has to pour solution. Then the nurse has to give assistance to doctor when necessary. Then second nurse observes client's condition for difficulty in breathing or unbearable pain throughout the procedure. Then maintain client in supine position and check client's vital signs hourly for 4 hours. The second nurse has to observe client's condition for difficulty in breathing or unable to unbearable pain throughout the procedure. Then she has to maintain client in supine position and check client's vital sign hourly for 4 hours. Then make the client comfortable. Always she has to make the client comfort. Then put up both hot side and place call bell within the client reach. Then click trolley and wash hands. Then document in nursing care plan. Next procedure. What is the procedure means? First, ask the patient to lie down in a prone position or side lying position, that is left or a right lateral position. Then disinfect the area with the disinfectant, that is the large area of the skin at the site of procedure. Then infiltrate the skin, subcutaneous tissue and periosteum, overlaying the selected site with the local anesthesia. Then needle inserted in skin through the subcutaneous tissue through cortex of the bone, which is sensed by a decreased resistance to the forward movement of the needle. Then the obturator is then removed and the needle is slowly advanced with reciprocal clockwise, counterclockwise twisting motions around the long axis. Next, after the sufficient penetration of bone, the needle is rotated several times in its axis and withdraw about 2 to 3 millimeter. Then the needle is slowly withdrawn using the same twisting motion employed during insertion. Then the core of marrow inside the needle is removed by insertion the probe through the cutting tip and extruding the specimen through the hub of the needle. Make touch preparation before fixing the specimen in 95% Zencus fluid or 10% formal saline. Then procedure, ask the patient to lie down in a prone position or sidewise, that is left or right lateral. Once again, I will repeat the procedure. Ask the patient to lie down in a prone position or side that is left or right lateral position. Then disinfect the area with the disinfectant. Then infiltrate the skin, subcutaneous tissue and periosteum, overlaying the selected site with the local anesthesia. Then needle is inserted in skin through the subcutaneous tissue through cortex of the bone, which is sensed by a decreased resistance to the forward movement of the needle. Then the obturator is then removed and the needle is slowly advanced with reciprocal clockwise, counterclockwise twisting motions around the long axis. After sufficient penetration of bone, the needle is rotated several times in its axis and withdraw about 2 to 3 millimeter. Then the needle is slowly withdrawn using the same twisting motion employed during the insertion. The core of marrow inside the needle is removed by inserting the probe through the cutting tip and extruding the specimen through the hub of the needle. Make touch preparation before fixing the specimen in 95% zinc fluid or 10% of formal saline. An examination of aspirated bone marrow. There are 5 methods are there for the examination of aspirated bone marrow. One is the direct smear, then concentration smear, third is the particle smear, and fourth is the imprint smear, then fifth is the histological section. So there are 5 methods are there for the examination of aspirated bone marrow. One is the direct smear, and second is the concentration smear, and third is the particle smear, and fourth is the imprint smear, and fifth is the histological section. Next, evaluation of bone marrow aspirator. We need to evaluate the bone marrow aspirator. What we need to evaluate means first is the cellularity. Under cellularity, the cellularity of the marrow is reported as non-cellular or hypocellular. Hypocellular based on the microscopic examination of marrow particle. Under cellularity, we need to know the cellularity of the marrow is reported as normocellular or hypercellular. Hypercellular based on the microscopic examination of bone marrow particle. Then cellularity of marrow should be correlated with the age of the patient. Then myeloid and erythroid, that is myeloid erythroid ratio. This is done by counting at least 500 cells and expressing the cells as ratio of myeloid erythroid cells. It provides quantitative information about the relative proportion of erythrocyte and myeloid precursors. Normal myeloid and erythrocyte ratio varies from 2:1 to 4:1. So myeloid and erythrocyte ratio, under that this is done by counting at least 500 cells and expressing the cells as ratio of myeloid erythroid cells. Then it provides quantitative information about the relative proportion of erythrocyte and myeloid precursor. Normal M/E ratio varies from 2:1 to 4:1. Then erythropoiesis. Erythroid precursor are examined for the marrow response, normal, increased or decreased. Then maturation, normoblastic or megaloblastic or micronormoblastic. Then erythropoiesis. Under erythropoiesis, erythroid precursor are examined for the marrow response, that is normal, whether it is normal or increased or decreased. Then maturation, normoblastic or megaloblastic or micronormoblastic. Then dyserythropoiesis. We will see the dyserythropoiesis. Next is the myelopoiesis. It is examined for normal response, that is normal or increased or decreased. Then maturation arrest will see. Then morphological abnormalities, that is hypergranular or absent granules. Then abnormal cells or blast will see. Next, megakaryopoiesis, that is they are examined for number morphology. Megakaryopoiesis, they are examined for number morphology. Next, lymphocytes. We need to evaluate the lymphocytes, whether it is normal or increased or abnormal. Next, we need to assess the plasma cells, whether it is normal or increased. This is about the evaluation of bone marrow aspirator. What we need to evaluate the bone marrow aspirator means first we need to see the cellularity. First we need to evaluate the cellularity. The cellularity of the marrow is reported as non-cellular or hypercellular or hypocellular based on the microscopic examination of marrow particle. The cellularity of marrow should be correlated with the age of the patient. Then myeloid and erythroid ratio. This is done by counting at least 500 cells and expressing the cells as a ratio of myeloid erythroid cell. It provides quantitative information about the relative proportion of erythroid and myeloid precursor. The normal myeloid erythroid ratio varies from 2:1 to 4:1. Then erythropoiesis. Erythropoiesis, erythropoid precursor are examined for the marrow response. whether it is normal or increased or decreased. Then we need to see the maturation of erythropoiesis. That is whether it is normoblastic or megaloblastic or micronormoblastic. Next, we need to see the dyserythropoiesis. Then myelopoiesis. We need to evaluate the myelopoiesis. It is examined for normal response, whether it is normal or increased or decreased. Next, we need to see the maturation arrest. Maturation arrest. Next, we need to see the morphological abnormalities, that is hypergranular absent granules. Whether the morphological abnormalities, whether it is hypergranular or absent granules. Then abnormal cells or blast. Then megakaryopoiesis. They are examined for number and morphology. Next, we need to evaluate the lymphocytes, whether it is normal or increased or abnormal. Then we need to see the plasma cells, that is normal or increased. And this is about the evaluation of bone marrow aspirator. Next, other also we need to evaluate, that is metastatic tumor cells, parasites and fungus. Then iron stores we need to see. And iron stores are evaluated by Prussian blue reaction. Then iron stores are commented as normal or abnormal or increased or decreased or nil. Then cytochemistry and special stains we need to do. So others are metastatic tumor cells, parasites and fungus. Then iron stores we need to evaluate. Iron stores are evaluated by Prussian blue reaction. Then iron stores are commented as normal or abnormal, increased or decreased or nil. Then cytochemistry and then special stains. Next, we need to see the nurse's responsibility. Nurse's responsibility are very important. First, before, during and after the procedure, what the nurse supposed to do, that we will see. First, we need to see before the procedure. First, physical preparation. Make sure the doctor have obtained consent from the client. First of all, we as a nurse should make sure the doctor have obtained consent from the client. Next, to provide clear explanation. Then make sure the puncture site has been cleaned. Next, the nurse has to monitor the vital signs. Then the nurse has to prepare the equipments. Then prepare trolley aseptically. The nurse has to follow aseptic technique. Then make sure equipments are completed. All the equipments should be completed. The equipment should not be, any equipment should not be missed. All the equipments should be completely present. Then make sure laboratory technician has been informed more earlier. The technician must be present during procedure because aspirated bone marrow is smeared immediately on a glass slide. So before the procedure, as a nurse, what she has to do means, first she has to do the physical preparation. That is, make sure the doctor have obtained consent from the client. Then provide clear explanation to the patient and family members. Then make sure the puncture site has been cleaned. Then she has to clean the puncture site with the povidone iodine. Then monitor the vital signs. Before doing the procedure, the nurse has to monitor the vital signs. Then she has to prepare all the equipments, then prepare trolley aseptically. Each and every procedure, she should follow the aseptic technique. Make sure equipments are complete. All the equipment should be completed, not even single equipment missed. Make sure laboratory technician has been informed more earlier because technician must be present during procedure because aspirated bone marrow is smeared immediately on a glass slide. Next, during the procedure, the nurse should perform some of the activities that are help the client to remain in the right position. The patient has to follow the right position, for that the nurse has to help the patient. Then assist the doctor in the procedure. That is, prepare the equipment and hold the client. While doing procedure by the doctor, the nurse has to assist the doctor for procedure and prepare the equipments and hold the client and monitor the vital signs during the procedure to detect the complication. The nurse before starting the procedure has to monitor the vital signs to know the condition stable of the patient. Then during vital signs or during procedure also, the nurse has to monitor the vital signs to detect any complication. Then after procedure or there, after the procedure, the nurse has to place the client in a supine position and apply sandbag at the puncture site at least for 6 hours to prevent a bleeding complication. Then observe the pressure dressing is tight, then clean and no signs of bleeding to prevent the infection. Next, observe the client until their condition stable and recover. Monitor the vital signs after the procedure. Next, tidy the equipment and make sure CSST instruments are complete before sending to autoclave. Once again, I will repeat the procedure what the nurse has to do before, during, and after the procedure. Before the procedure, the nurse has to do the physical preparation. That is, make sure the doctor have obtained consent from client. Next, provide clear explanation to the patient. Then make sure the puncture site has been cleaned up. Then check, monitor the vital signs. It is very important to know the condition of the patient. Next, she has to prepare the equipments. Then prepare trolley aseptically. Then make sure equipments are complete. Then make sure laboratory technician has been informed more earlier, because the technician must be present during the procedure, because aspirated bone marrow is smeared immediately on a glass slide. Then during the procedure, the nurse has to follow some of the activities, that is, help the client to remain in the right position. Till the procedure, the patient should remain in the right position. For that, the nurse has to help the patient. Then assess the doctor in the procedure. Always the nurse has to assess the doctor. Whatever is asking, we need to respond. Then prepare the equipments and hold the client. Then monitor the vital signs during the procedure. Before also, we need to monitor the vital signs. During the procedure also, the nurse has to monitor the vital signs to detect any complication. Then after the procedure, place the client in supine position and apply sandbag at the puncture site. It at least for 6 hours to prevent bleeding complication. Because place the client in a supine position, the patient should be in the supine position and apply sandbag at the puncture site. Why we are applying sandbag on this puncture site means to prevent bleeding complication. This should be last for 6 hours. Then observe the pressure dressing. Pressure dressing is tight, clean, and no signs of bleeding.